Advanced lines are long IV catheters placed in a large vein. These can include central lines and PICC lines. Advanced lines are used for long-term IV access for infusions, medications, and TPN. These lines can stay in place for weeks or months. Some people may have a central line catheter for years. Your child may have a PICC line or a central line. This is a PICC line. This is a central line. Advanced lines get flushed with normal saline and heparin. Follow your clinician's guidelines for flushing amounts and frequency. You will need the following supplies to flush your advanced line: 1 saline flush per lumen, 1 heparin flush per lumen if ordered by your clinician, 1 swab cap per lumen. Never reuse syringes. If you cannot flush your catheter, do not force it. Notify your clinician. Remove any air out of your saline syringe and place the cap back on. Remove the swab cap off 1 lumen and discard. Attach your saline syringe. If your advanced line has a clamp, unclamp it now. Pull back on the syringe plunger to see if you get blood return. If you do not get blood return, notify your home health nurse or clinician. Push the ordered amount of saline with a push-pause technique. On the last push, if the advanced line has a clamp, close the clamp at the same time. Repeat these steps for heparin if ordered. Apply a swab cap when finished. To help remember when to flush your advanced line, follow the SASH acronym in order. S is for saline, A is for administering your medication or TPN, S is for saline, H is for heparin. The dressing on your advanced line needs to be changed every 3 to 7 days, depending on the cleaning products used. Typically, a home health nurse will come to your house to perform routine dressing changes. However, there are times where you will have to change it in an emergency. The following are emergency reasons: the dressing is peeling off, the bio patch is wet or dirty, there is moisture under the dressing. Changing the dressing is a sterile procedure. Sterile technique decreases germs from contaminating your advanced line. Infection to your advanced line can be life-threatening if not treated. It is recommended you have 2 people present. Follow these steps when changing the dressing. Gather supplies and place them on a clean area. You will need a central line kit, a bio patch or other antibacterial dressing, a stat lock for PICC lines only. Wash your hands with soap and water and apply gloves. Open your central line kit and apply the face mask to yourself and to your child. If your child will not keep a mask on, turn their head away from the advanced line while changing the dressing. Remove the sterile gloves from the advanced line kit and set aside. Carefully open up the BioPatch and StatLock packaging and allow the BioPatch and StatLock to fall into your advanced line kit. Start to remove the old dressing. You can use an adhesive remover to help the dressing come off easier. Start on the edges and work towards the center. Remove the BioPatch and StatLock. Check the insertion site for redness, swelling, or drainage. Notify your provider immediately if any of these things are seen. Remove gloves and apply sterile gloves. Open the package of sterile gloves. Only touch the 2-inch border around the package. The inner part is sterile. Only touch gloves by the cuff. Lift the glove by the cuff with one hand and slide in the other hand. Pull the glove over the hand with the cuff only. Pick up the other glove with your sterile gloved hand by reaching under the cuff. Pull the other hand in and pull glove on by the cuff. If you accidentally touch a sterile glove on any surrounding area, it is no longer sterile. Throw those gloves away and start over. Open the ChlorPrep package and remove the applicator. Pinch the weans on the applicator to release the fluid onto the sponge. Do not touch the sponge. Use the sponge to scrub the insertion site, advanced line, and surrounding skin for at least 30 seconds. Allow to completely dry without waving or blowing. If you have a PICC line, apply the StatLock. Skip this step if you have a central line. Make sure the arrows on your StatLock face towards the insertion site. Place the holes on the PICC line weans over the posts on the new StatLock and snap the lid shut. Place stat lock on skin so the advanced line is not bent or kinked. Pull the backing off on both sides so it sticks to the skin. Place the biopatch over the insertion site with the blue side facing up. The slit in the biopatch must be in line with your advanced line. If your child uses a different antibacterial dressing other than a biopatch, follow your clinician's orders. Apply the Tegaderm to cover the insertion site and surrounding skin. Remove the white tape around the edges. Label the Tegaderm with the date you changed the dressing. Throw away the used supplies and remove the sterile gloves. After you change the dressing, you need to change the injection caps. Gather supplies and place them on a clean area. You will need 1 injection cap per lumen, 1 swab cap per lumen, 1 alcohol swab per lumen, and 1 saline and 1 heparin flush per lumen. Wash your hands with soap and water and apply clean gloves. Remove injection cap from package without touching the end. Connect the saline syringe to the injection cap. Push the saline through until you see saline come out the other end. This is referred to as priming. If your advanced line has a clamp, clamp that now. Remove the old injection cap by twisting it off. Clean with an alcohol swab for at least 30 seconds and allow to dry. Remove plastic end on injection cap. Twist the new injection cap with the saline attached onto your advanced line. Flush with saline and heparin as ordered. Apply a swab cap. Notify your clinician for the following reasons. If your child has a fever of 100.4 or greater, if there's redness, swelling, pain, or drainage around the insertion site, if the advanced line gets pushed in or out during a dressing change, if the advanced line breaks or you are unable to flush your line, sudden shortness of breath or chest pain. If you have any questions, please reach out to your nurse educators.